So I'm told that I was just talking like y'all could hear me, but hopefully now you can. And so I'm going to do that all over again, which is basically just to welcome you and thank you so much for joining us here on Excuse Me, Doctor. My name is Dr. Mel, otherwise known as Dr. Melissa Clark. We are here doing what we do every week on Excuse Me, Doctor, which is make sure that you have all the information you need to make wise health decisions for yourself, your family, and even your community. And I'm just going to ask you to hit that like button if you're checking us out on Facebook, Dr. Melissa Clark, or on YouTube, on the Dr. Melissa Clark YouTube channel. Please hit that subscribe button. We really appreciate you for it. And of course, because this show is about you, we want to make sure that you put all your questions, all your comments in the chat, because we're going to get to them. So make sure you got those fingers ready to put your thoughts down. Now, let's get into creating an amazing week for ourselves with all the health topics we're going to cover tonight. And to do that, I have to have Mr. Wayne Bruce with me, my co-host, in the studio. And we have an amazing announcement tonight. So, Wayne, where you at?
I got to bring in an announcement. I just can't come in alone. The announcement is bringing to the stage, ladies and gentlemen, tonight, we have a brand new co-host.
Brand new
guest co-host. Her name is Larisha Harris. She is incredible. Larisha is, you heard her and have seen her on ESPN Sports. She covers college games. She covers the HBCU games. Also, she is a mom boss. Let's say that.
Yes.
So she is a new mom boss. Everybody welcome her. Throw some love on the screen. Go in the chat, show her some love. She has her own segment tonight, man. We're excited to have Larisha tonight.
Yay.
And most nights she's going to be here. So, you know, as a mom boss, she may not be here, but we're excited to have her. Hey, Larisha.
Yeah. Welcome, Larisha.
Hi. Thank you guys for having me. I'm excited to be a part of the show.
Well, and we are excited to have you because you all bring the word from the street. You all help us break it down so everybody can understand what we're talking about. So I just really, really appreciate your being here. Thanks so much for joining us.
Of course.
Yeah. So, and you're a mom to who?
I am a twin mom to a beautiful baby boy and baby girl, Raiden and Raya Collins. They are 18 months now. So y'all pray for me because we're learning timeout and we're learning how not to climb on the TV stand and play with, the electrical sockets. So y'all just pray
Ah,
for
yes.
Wow.
Prayers going up. Going
Prayers
up.
work. Prayers work.
me. Yes.
So
Absolutely.
let's get into it, Dr. Mel. Let's get directly into it.
Right. We are talking about what tonight? Attention deficit hyperactivity disorder, otherwise known as what?
ADHD.
ADHD.
Right. So we're going to be talking about getting help, diagnosing it, what you should know. I know I often wonder if I have it. I feel like I have an attention deficit because there's so much stuff to pay attention to. But it's a very specific diagnosis, and we're going to hear from experts who are going to walk us through everything we need to know. So hang in there because we're going to get to that in a minute. But first, we have to do what?
The recap.
Right.
There we
Our
go.
weekly recap.
We got it up.
So I'm going to kick it off. We're going to just a public service announcement for those of you who did not know. The FDA just announced that if it's been more than 6 months since you've had the updated bivalent COVID booster. Bivalent means it covers the original COVID and it covers the Omicron variant. If it's been more than 6 months and you're over 65 or you have a poorly working immune system, you're immune compromised, it is time for you to get a re-up. Okay. So, because if you're over 65 and you have a lowered immune system, you're in that high risk group that's still accounting for hospitalizations and even deaths due to COVID. Granted, they've gone way down, but we know that the immunity that the vaccine provides wanes over time. So, 6 months, if it's been that, make sure you go and re-up. And if you've never had that bivalent vaccine, the one that covers both strains, and you're over 6 months old, boom, now is the time to get it if you've never gotten it before.
So, Dr. Mill, I want to step in here because, as you all know, I am a twin mom and they are 18 months now. I saw something about depression correlating with heart problems for those who have dealt with pregnancy within that 2-year span. Help me out here. Help me to understand because I actually dealt with depression during my pregnancy and afterwards. Are you saying now I'm at risk of heart problems?
Well, that is what this new study suggests. So, pregnant individual, if you're depressed while you're pregnant, it does show that up till 2 years afterwards, you have a higher risk of heart disease. And it doesn't
Wow.
mean that you're definitely going to have it, but it's something to watch out for and talk with your doctor about. And it can include some things like, electrical problems in the heart or weakened heart muscle, high blood pressure, blocked arteries. So, if you have any kinds of symptoms that would suggest that dizziness, chest pain, definitely get it checked out right away. It's important. It's not a high risk, but it's a heightened risk over people who didn't have depression during pregnancy.
So it's something to just inquire about.
Exactly.
Okay.
Exactly. And of course we know that as African American women during pregnancy we have higher rates of complications like depression. So and it's often underdiagnosed.
Mm.
So that's even more reason for people who are experiencing depression during pregnancy to talk with your doctor about it. Talk with a therapist, talk with a specialist, or if you don't have access to that, call 988 because that's that emergency number where you can reach out to get mental health help if you need it. So, really important.
Really important. Really important. Hey, look. So, I'm all about the food section of of the show. But I must say I have, lost 30 pounds. I'm just
All
saying.
right.
Everybody I've lost 30. So look, tell me about the 4 foods foods are good for you losing weight, but getting a little older, need to protect the brain. Tell us about the 4 foods that healthier for the brain?
First of all, we need a high five noise to high five you for the 30-pound weight loss. I'm just saying.
I mean, we got this.
There you go. There you
Yeah.
go. You're right.
Let's go, Wayne. Good job. Good job.
So, and then you bring up an important point about the health of your brain. We know that a plant-based diet over years is best at preserving brain function, but there are 4 specific food groups that kind of stand out that seem to protect the brain more than others, and at the same time they also protect your heart. So it's like a twofer. So first of all, green leafy vegetables like kale, collards, broccoli, they're rich in, brain important nutrients like vitamin K and beta carotene. Then we have fatty fish, right?
Mhm.
You want to get your salmon, cod, canned light tuna. You want to get that stuff in. Those have lower levels of mercury, but they have omega 3s, which are really important for the brain. Then, number 3 are berries. All those beautiful colors, the red of the raspberry, the blue of the blueberry, the black of the blackberry. Those things are actually chemicals called flavonoids that really help help in memory. That's what research has shown. 2 or more servings a week, just like the fish, you want to get in 2 or more servings a week of that, help to delay memory decline in women. That was one particular study. And then finally, last but not least, walnuts. Walnuts specifically have been linked to improve cognitive test scores because they're high in, again, omega 3 fatty acids, a specific one called alpha linoleic acid or ALA. That also leads to lower blood pressure and cleaner arteries. Like I said, what you do for your brain, you're also doing for your heart. So 4 things: green leafy vegetables, fatty fish, berries, and walnuts. Get them in. You heard
Okay,
it
so
here.
not
So
flavonoids. We just talking about flavonoids.
Yeah. You don't need to have the big clock on your chest. You just
No
need to eat some berries
flavonoids. Just
for your
flavonoids.
flavonoids.
no
Correct.
cashews in there? Like no
Well,
cashews?
all nuts actually are beneficial. But walnuts have higher levels of omega 3. So get your cashews in. They will help in terms of heart health as well.
Somebody
I'm
likes
not
cashews.
I'm not a
Apparently.
fan of walnuts, so
Oh, yeah.
sorry.
Well, you can get it in the berries and the fatty fish and the green leafies.
So Dr. Mel,
You're right.
just follow up to that. Can we add supplements? The omega-3 supplements, will that help also?
Yes, absolutely. Omega 3 supplements have also been shown to be beneficial as well. So people take fish oil tablets, for example, or eat flaxseed.
There you go.
Awesome. Dr. Mel, we know that mammograms and making sure that women are checking themselves frequently is something that we've been taught. A lot of us
Mhm.
have been taught that. But I see that there's a new study out and really initiating saying that Black women should start earlier, meaning getting checked earlier. What is that
Right.
about?
So this is the deal. So, mammogram guidelines that are out say if you're of average risk for breast cancer, start screening at age 50. However, the study from the American Cancer Society showed that among women in their 40s, deaths from breast cancer were nearly double when you look at
Wow.
Black women compared to white women, right? And so that's really enough to say Black women, we need to be talking to our doctors about getting screened starting in our 40s because there's that higher risk. And the guidelines do give a little bit of wiggle room in terms of, you know, if you choose to start at 40, you can. So it's not a hard and fast rule to start at 50. If you're Black, consider starting earlier in your 40s.
There you
Make sure you
go.
bring it up to the doctor.
There,
Absolutely.
there you go.
Absolutely. It's all about advocating for yourself.
So here's the deal, y'all. With a new guest host. What we going? Are we guest host, co-host? What's going on, Dr.
Y'all
Mel?
are co-hosts.
I
We're
mean,
all in this together.
I'm feeling, I'm losing title here.
No, we're a team. We're a team.
We're a
We're a
team.
team, and
Okay,
you are our one
co-team.
and only. You are our producer, so
Okay.
Right.
you have your own little special hat.
So look, this is important for everybody. This next thing, Larisha came up with her own segment, y'all. I mean, Larisha came up with her own segment. Go ahead, Larisha. Go ahead and introduce the segment.
So we need to know your opinion on various things that we see regarding medical information, out in the world and social media, various digital platforms. We need to know your opinion about it. So this new segment is called What Y'all Think? What y'all think? So, what y'all think about this, right? As a Black person, when we go to the doctor or the hospital, we already know that we have to advocate for ourselves a little bit more. Like that sort of stereotype exists, right? So, oftentimes we are concerned about, discrimination or various biases. So the question is, do you change up your persona or your behavior when you go to the doctor? A study showed that about 3,300 Black Californians, about out of that number, rather, 33% change their speech, their dress to put the doctors at ease. So, what y'all think? Do you change who you are, put on an alter ego, code switch a little bit when you go to the doctor to show yourself as educated, to show yourself as knowing what you're talking about? Or do you not? Do you remain the same as you are when you or before you step in the door?
I think
So
that's an excellent question.
that's
I
an
mean,
excellent question.
yeah, and not only that, I think that study showed that 25%, which I thought was really high, out of that 3,300 Black Californians, 25%, one in four, said they just don't go to the doctor because they don't want to
Which is
deal with it because they're
crazy.
concerned. I know they're concerned that they'll be treated unfairly.
So,
So,
but you know what? That's a question for anybody. That's a
Hmm.
question for people change up. Everybody changes up. That's not like a black or white question. I know we want to know black or white, because but people change going into the doctor.
true, but I think the question that was asked in that survey and that we're asking tonight is,
Mhm.
do you do it because you think that it will lower your chances of being discriminated
Right,
against or experiencing bias? So
right.
yeah, I mean, I think, everybody might, put on a clean pair of drawers when they're going to the doctor, right? Okay.
Really?
But
Do we have to put on
Listen,
clean ones?
yes, I am
yes,
from the South, and I was always taught you put on
yeah,
fresh undies and a fresh bra.
exactly.
You do not go with
Don't
that
go
old
use
normal, that
underwear.
good
I'm
dandy
out.
candy.
We want to know though.
Exactly.
We want to know
Right.
because you may face racial discrimination. Do you code switch at the doctor? Put it in the
Right.
chat, and we're gonna get back at the end of the show with it. All right,
Right. We want to
everybody.
know what y'all think.
We want to know.
So, right. Well, thank you, Larisha, for that segment. We will, again, make sure you put it in the chat what you think. Do you code switch when you go to the doctor because you're concerned about discrimination and bias? Thank you, Larisha. Thank you, Wayne. We're going to see you back in a little bit. We are going to move into our segment for tonight, which has to do with attention deficit hyperactivity disorder, or ADHD. So you've noticed perhaps, or maybe the teacher says that your child daydreams a lot at school, might be easily distracted at home when they're trying to do homework or chores. They might fidget constantly, maybe not. And you might be wondering, do they have attention deficit hyperactivity disorder, or ADHD? How do you figure that out? And if they do, then what? We have two incredible guests with us tonight. The first is Dr. Lorelle Bradley. She's a double board certified holistic and integrative pediatrician. She also holds an executive MBA, but she's been treating patients with ADHD for over 20 years, and she focuses on holistic treatment approaches. And she's also dedicated to increasing access to healthcare and closing health disparities. Thank you, Dr. Bradley, for joining us tonight.
Thanks for having me.
Absolutely. And our next guest is Tiera York-Jones. She's a licensed certified social worker, clinical, who has 30 years of professional experience in guiding children, teens, adults, both individuals and couples, as well as families through the process of change, identifying their inner strengths, and supporting emotional healing. She specializes in coping skills, mood disorders, and behavioral issues, including ADHD. So, welcome, Tiera. Thank you so much for being a part of our show.
Hello, thank you for having me.
All right, so we're going to get right into it because, Dr. Badley, we need to know, what is ADHD and is it different from ADD?
I'm glad you said it. Actually, attention deficit hyperactivity disorder, and there's now updated ways to describe ADHD. So ADD now is a part of ADHD, inattentive presentation. So there are three types of ADHD: the inattentive presentation, the the hyperactive impulsive presentation, and then there's a combined. So that nomenclature has been updated in the what we call the Diagnostic and Statistical Manual, edition number 5. And more or less, ADHD describes developmentally inappropriate levels of inattention, impulsivity, and hyperactivity.
So I started off talking about, this in your child, but can it be diagnosed in adults as well?
Usually, an adult that has ADHD may have had a misdiagnosis or no diagnosis in childhood, with an exception of a head injury. That can
Mm.
sometimes affect the prefrontal cortex and areas that for attention and can affect concentration.
When you
So
say
usually,
prefrontal cortex, you mean of the brain, right? You mean the
yes,
part of the
part of the
brain that does
brain,
that. Okay.
exactly, the part of the brain that more or less the frontal cortex is right underneath the forehead. So,
Hmm.
and those areas are responsible for concentration, focus, and decision making as well.
Got it. And how is it diagnosed? How do you make the diagnosis?
Usually in children, we can start at age 4. Again, a very common scenario is what you talked about, where teachers are a little concerned or parents are a little concerned about the way that children either are behaving or not focusing. So that hyperactivity and impulsive type is the type that originally we just had as ADHD. Those are the
Mm.
kids that are bouncing around and fidgeting all the time, rush an answer before the question is finished and things like that. So you bring that information to the attention of your pediatrician or your primary care doctor that takes care of kids. That's usually the first step. And they
Mhm.
usually will take a good history, understanding, if this is not just at home, because that's part of the diagnostic criteria. It can't just be like at school or just at home. It needs to be in more than one place,
Mm.
a coach or a church, something like that, where there's the report where the same activity is there. And so from there, they usually can do a behavioral checklist, or there's some other questionnaires that parents can do or send to a teacher. And
Mhm.
from that, there's an evaluation of that. But also, what the responsibility of the primary care doctor pediatrician is to rule out other things like lead poisoning.
Mm.
Sometimes kids that with that staring, you worry about seizures, the petit mal or the absence seizures. And so you might want to get a good history of that, and there may be a referral to the neurologist. The other thing, and so there are blood tests, thyroid we check, vision and hearing, very important, because sometimes that staring or inattentiveness is due to not being able to hear, not, and then the poor performance in school, not being able to read. Sometimes also there may be concern about specific learning disorders like dyslexia.
Mm.
So it's a process, but
Yeah.
a lot of times when the pediatrician is used to that type of diagnosis, there can be an assessment and a diagnosis made pretty quickly.
So it sounds like ADHD can be confused with a lot of different things, and it's important not to try to just make the diagnosis yourself. It's important to have a doctor go through all these other things: dyslexia, lead poisoning, trauma, all these other potential related or unrelated things. Um, so Tiara, can you take me through how you see children being affected by ADHD in school? And are you ever the one, or are teachers ever the ones that may suggest to the parent that the child be evaluated?
Yeah, so generally a student may be having inattention in class, and generally that will look like a lot of disruption, and which will lead to behavior problems. Well, initially being focused as the behavior, not understanding what's going on with the student. So it looks like the kid's just being bad in class. So it leads
Mhm.
to them being sent to the office or being asked to step out of class or having to go to guidance, or it could be a variety of things that could lead to them being singled out. It's also not fair to other kids that when a kid is having trouble staying in their seats or blurting out, roaming the class, fidgeting, perhaps picking with another student, it's disruptive to the whole class and to the other students who are learning. So usually the first line is to have the child removed from the classroom. So then that
Mm.
leads to poor
Which
self-esteem.
yeah, exactly. I was just going to say that.
Yeah,
Yep. Uh-huh.
poor self-worth. They're having negative talk to themselves, and kids are teasing them. So it can lead to a lot of developmental problems for the children in themselves.
What about the children that don't have, because we heard from Dr. Bradley about how, hyperactivity is one component, but sometimes it's more just the inattention as opposed
Mhm,
to the hyperactivity and the blurting out and the disrupting. Do those kind of
mhm.
children sort of get missed and it goes under the radar potentially for a long time?
Well, I think that a student who is primarily inattentive, they are not able to complete their schoolwork. So then their diagnosis will, or suspicion of a diagnosis will come out from a teacher perhaps, and that they're not completing any of their assignments, and they're just sitting in there staring out the window, or they're fumbling with things in their book bag. They could
Mhm.
just be not able to do their work. So then they would come to light and some discussion would be had.
So, Dr. Bradley, what are some of the causes around of ADHD, and what are some of the beliefs um, around the causes that people don't have right? We're big into debunking misinformation here. So, how would you describe that?
The major cause that has been identified is a genetic factor.
Mm.
Usually, a child that has ADHD or some of these symptoms probably can identify one parent or somebody within the family, even a grandparent that had a similar
Mm.
type of diagnosis and needed management or treatment and intervention. So that's one thing. Now there are other things, and when babies are born to mothers who might have used substances or smoked or had alcohol. So sometimes those children will also have some features that can fall under attention deficit hyperactivity. And then sometimes there are toxin exposures. Of course, in all honesty, lead can cause that as a symptom. And they would respond to some management or treatments, but they need to get the lead taken care of.
Sure.
So that and again, brain injury, premature kids sometimes are at increased risk as well. Now let's debunk. It's not caused by eating too much sugar. It's not caused by staring too much at the TV. It's not caused by poor or different parental skills. And it
Mm.
also is not caused necessarily, and this is a very old myth, but there's a lot of debunking of that with the latest literature about being born into poverty or those types of environmental stressors. Um, now, there can be some other issues that happened around that, but it doesn't necessarily mean they had the diagnosis of ADHD. They may
Right.
just need some support mentally and behavioral support, which is different than a full diagnosis of ADHD.
Right. And I think it's really important that parents know that it doesn't have anything to do with their parenting skills,
That's
right?
important.
But then the question is, once you have a diagnosis of ADHD, Tiera, how can children in school be successful despite their challenges? What is the process that parents need to do to help their children succeed in school on the school side?
Yes, so simultaneously, if a child is referred, generally there's a team who will review various techniques and things that teachers have tried to do inside the class to try
Mhm.
to manage the children. Probably some parent-teacher conferences have been had. Um, if they aren't successful, then we will meet with the student. Definitely, as the school social worker, we will meet with the student and the family, have some conversation, perhaps do some assessments and questionnaire. Certainly refer to a medical provider, primary care doctor, simultaneously, along with having what's called a student support team, like review what's been happening. And then that team would create some behavior techniques to support the student in the class around academics and behavior. And then if
Mhm.
those aren't successful, then the team will come back together. And then there are a couple of educational plans that can be put in place. People are very familiar with the IEP process, which is the individual educational plan for students. And so
Okay.
that's a whole team comes together, looks at all the data that's been collected, and determine whether the student could benefit from having an educational plan, which is very specific to what the data shows for the
Mm.
student. And then goals are created. All the teachers and all the extracurricular providers and whoever else in the school will get copies of it, and it's the responsibility to implement those strategies and goals in the classroom to help support the student. And so some
Okay.
very basic ones could look like providing the students with frequent breaks. So if they're doing their
Mhm.
work and they start to get fidgety or whatever, then they can say, okay, you can take a break. Well, the student can ask for the break depending on the level. Um, Reducing distraction, providing preferential seating in the classroom. So there's a variety of things that can be done to support the student and
Extra time to complete
extra
assignments,
time.
perhaps? Okay.
Absolutely. Yeah.
Uh-huh.
And
So Mhm. No, go ahead.
no, I was just going to say, and those kind of things can be put in place to support the student throughout their academic time.
So I think we already have a question from the chat from Marv West. If you can't get an IEP, individual educational plan, right? IEP from your school district for whatever reason, where can you get an IEP? Are there outside professionals that also can help with that process?
I'm not familiar that there are outside providers that can provide it because it is the responsibility of the special education team to create that document for the student.
Okay.
But certainly outside providers can support the data that encourages developing that plan for a student.
Got it. Got it. Okay. So, yes, I was actually going to go back to you, Dr. Bradley. So, you can throw in whatever you're going to say as you talk about medical treatment. Go ahead.
Well, in conjunction with medical treatment, what the schools are able to provide is essential. I'm really kind of concerned that the person wrote about not being able to have access to that. That's violating the Americans with Disabilities Act,
Hmm.
and that is reportable. So perhaps even leveling up if the principal won't provide for it, to go to the superintendent's level to get the evaluation, because advocating for that child is necessary, and
Got it.
that system needs to be reported.
Got
I'm a
it.
strong believer in the advocacy for the children, because of the Americans with Disability Act. Because in all honesty, it is considered a disability. I hate saying that word, but it's good just because of the ability to get resources.
Protection. Yeah. That that
So
affords.
that's it. Yes.
So before we move on to treatment, though, what if the person is in private school or a Christian school or non-public school setting? Are they still covered by that? Um,
Yes, I have personal
okay.
experience But you can go ahead.
Yeah, I was just going to say yes, the private schools, all the educational components have the IEP process in place. There should
Mhm.
be some system internally in the school that would provide the evaluations and assessments.
Got it. Okay.
And even the public school system can do that within the person's district where they live. They can actually make that request if the child,
Mhm.
even if the child is in a private school.
Got it. Now to the treatments. Um, what are treatments for ADHD, and what are the success rates?
Sure. We already did talk about some of the treatment that's considered. The school involvement and support and behavioral interventions are a significant part of the management, is what I will say,
Okay.
for ADHD and students with ADHD. So there are a variety of options for treatment, and I'm going to go through the most popular and then talk about some, some other things to support. So the most popular are stimulants. This is the Adderall, the Ritalin, your Concerta, and those categories of medication. 60 to 80% success rate as far as eliminating the symptoms when on and taken correctly.
Mhm.
The other are non-stimulants, and that can be some alpha-2 agonists. Capve, Strattera is under that category. So that's another type of category that are used. They're usually used in conjunction with the stimulants when there may be, they've been on it and then all of a sudden it stopped working because they grow or their brain develops differently.
Mm.
Sometimes there are antidepressants used, but this is usually under the guidance of a psychiatrist, usually a primary care pediatrician is not going to do and then they'll do and they'll look for some comorbidities as well.
Mhm.
So those are the medications.
When you said they look for comorbidities, break that down for us. What does that mean?
What a comorbidity is another type of disorder in addition to the disorder we're discussing. So
Mhm.
it's not unusual for children and adults especially to have things like anxiety or
Okay.
depression with the ADHD.
Okay.
And so the use of other types of neuropsychiatric medications, a lot of times is quite helpful with
Like
treating.
antidepressants or anti-anxiety medicines if it's
Absolutely.
appropriate. Got
For
it.
children, there is an indication for antidepressants, yes, and
Mhm.
there will be anti-anxiety medications, but again, that's usually a psychiatrist to deal with that. 'Cause again, you want to
Mhm.
make sure you're dealing with the right thing. And the right disorder and treating the right disease. So, yeah.
Okay. And are there any non-medication outside of the school accommodations, anything that you as a pediatrician also recommend? Like you said that sugar doesn't cause ADHD, but do you recommend any dietary changes, for example?
But of course I do. You mentioned the walnuts and the berries and the green leafy vegetables, as well
Mhm.
as the fatty fish. That's food is medicine. And
Mhm.
I do want to tell Larisha that sometimes it's not a bad idea for the cashews because all those nuts not only have they also have some serotonin in them, believe it or
Mm.
not, and they're
And
really
why is serotonin important?
Serotonin is important because it's one of the neurotransmitters that helps calm the brain down and also helps
Mhm.
with just the excitability areas that happen with ADHD. It helps calm them down.
Mhm.
Um, Mind body modalities, meaning meditation, guided therapy, prayer, as well as yoga. Lots of studies with
Oh.
yoga in children, like in a
Mm.
kindergarten, those wild kids all over the place. They come in and they learn some they learn some child's play and downward dog and
Uh-huh.
warrior. And next thing you know, they're like off to
They're
their nap.
chill. Right.
And they are. So there's the
Okay.
mind body modalities. There's nutrition, of course. We talked about food is medicine, and in that also, so low sugar is for sure something that is helpful, but because of its addictive nature. But casein, meaning the protein that's in milk,
Mhm.
and as well as gluten, the studies are there to have low gluten, low casein, low sugar diets and limit, if not eliminate, processed foods. And
Wow.
lastly, there are supplementations that are, so you talked about some of the vitamins, vitamin D, vitamin B, methylated vitamin B12, meaning activated B12,
Mhm.
and folate, because it helps with detoxing the brain. And because that's an issue with a lot of kids that have any type of mood disorder, and definitely that have ADHD. Magnesium and zinc.
Okay.
So, and of course, the omegas, omega 3s. And if
Right.
they can't get, I say the omegas because sometimes flaxseed oil is really good to include in the diet as well.
Hmm.
Again, since, and I like to think of all those fatty acids, it just coating the brain to make it calm down, just greasing it all up so those neurotransmitters can just be nice and flow through. So,
Right. Right.
yeah.
So that's great. I know. I hope people had their pen and paper out. But remember, it's recorded. You can always go back and catch it all on YouTube. And I want to make clear though, you're not suggesting that the non-medicines substitute for the medical approach. They kind of work together, right?
They work together, and I will say this has been an approach of mine, particularly with African American families, because we're kind of leery about medications. Um, and so I like to tell them that I'll work with them to get their bodies prepared, and we will look into the medication management
Hmm.
as needed. I'm going to tell you, when the kids truly have ADHD and nothing else, you pop that stimulant on them and boom, right away, they are just like
Mm.
right there. And that's why
Okay.
the correct diagnosis is important.
Right.
So
No, that makes perfect sense. I can't believe the time is flying by. We have to bring Larissa and Wayne back in to see what is bubbling up on the chat. So, Larissa, Wayne, come on back in. Bring us what the audience is talking about.
Hold on.
Definitely.
You on mute, Larissa. You're in now.
Am I back? Am I back now?
Yes, we
You're
can
back.
hear you loud and clear.
Okay, perfect. Because we do have some questions. This one first, basically a true or false question. When private schools don't implement the IEP process, is it true or false that an educational consultant specializing in ADD, ADHD can assist?
So, to my knowledge, no. I work in a public school system, so we have all the components in place. So I can't totally speak on what private schools do, but just in talking with colleagues, and I have colleagues that work in private schools, they do honor IEPs.
Okay.
I'll say to their ability. Um,
Hmm.
I, I had to actually take my daughter out of the private school because they did not have the capacity
Mm.
to meet her needs. And it was different because, but they were also offering for her to get like speech or whatever else she needed outside and go, because sometimes they do offer the ability to go to a public school for the services. So it
Mm.
depends on the private school, and it depends on the district and the support. And having an advocate, nothing beats it.
Okay.
Another question here. This one is from Valerie Spalding Parker. She says, I think I have ADD, but I have found ways to compensate. Should I still be evaluated as an adult?
Excellent question. I'm sure Valerie Spalding Parker, you are not the only one.
Yeah, I say absolutely yes. Seeing her medical provider, even taking it a step up and going ahead and reaching out to a licensed social worker or psychologist or even a psychiatrist, whatever her comfort level is, and definitely have a conversation, get some assessments done, and to determine if in fact that is the case, that she can get some treatment, some coping strategies, and
Right.
have a good life.
Wow.
All right.
We have another question from Marv West. Where do you find educational consultants?
Is that what you mean? Is that the same? And that is that I'm adding, is that the same as an advocate that you mentioned at the end there, Dr. Bradley?
Being outside of an educational environment, there are people that actually have practices for education consultation. A lot of times they are in the social work or psychiatric or psychological um, arena. Finding an advocate, a lot of times the way I was able to know about advocates was through behavioral centers, and their ability, saying that that's offered as I don't think that they're necessarily easy to find, but I think that they're so willing to help when they are put to work.
Mm.
Yeah, I agree. And I would recommend that that person seek the professionals in the school for
Mhm.
support in that area and some
Mhm.
guidance in the community. And
Okay.
also in the district. I know Dr. Bradley's talked about the district level. And so
Mhm.
they're definitely the supervisors and the bosses in that area. So if whatever is not being provided in the school, they definitely have every right to skip over principals and everyone else and go to to the district level.
Wow.
Wow.
Okay.
Sometimes lawyers serve as advocates as well,
Absolutely.
Mm.
Do you find
particularly
Okay.
so
particularly
so
when
I
their rights are violated.
so
Mm.
I have a question, and I want to just shout out some people. I read about this story a long time ago, and it just happened to include one of my fraternity brothers who was giving students at elementary school in Baltimore meditation. They were like one of the first
Mm.
ones to provide a meditation room for them at the Robert Coleman elementary school. Have you guys heard about that? Is that a
I,
basis for?
so I haven't heard about that specifically, but absolutely. And so I am a social worker in the school, and I have a colleague is there, and so we create our spaces so that they provide some soothing comforts, low lights, soft music, um,
Wow.
tactical things to do with their hands, coloring, Play-Doh, sandboxes, and it sounds elementary, but on the high school level, where I am, those children definitely love doing that. And so doing the breaks or doing change of class when they're having a hard time, they know to pop in and get a reset. If something's
Right.
going on, you have a space to talk. So Baltimore City has provided those services for the students in the school, and they utilize them.
Wow.
That sounds wonderful. I feel like I need to pop in sometimes. But back to Valerie Spalding Parker's question, what are some techniques that adults should be using if they are living with with a diagnosis of ADHD and have to work, and function in a
Mhm,
workplace?
mhm. So definitely paying attention to distractions. Self-regulation is the main thing. And if they're having a difficult time doing it on their own, I would suggest, seeking out a licensed provider, social worker, counselor, to see on a regular basis to help provide some of those coping strategies to help them be able to deal with whatever is going on that's keeping them from being productive. So, organizing is a big thing. Decluttering is a big thing. Just
Mm,
being able to know when they're out of control and to kind of be able to pull themselves back in. So that's mindfulness is the term for that. So being able to self-regulate and recognize what's happening and having tools in the box is what we call it
mhm.
to pull from for whatever the situation is that they need help with. at that moment.
Mhm.
And so it doesn't just happen. It's not like a one-stop shop. It's not a snap of a finger. You have to learn these techniques because it's like adjusting behavior.
Mhm. It's a process. Okay.
Absolutely.
All
So
right. What else do we have out there? Go
I
ahead,
actually
Larissa.
have a question. You mentioned some of the various foods that would be helpful, and some foods that you should keep away or not let children have. Essentially, where does red dye, the red food coloring, those type of foods fall? Because I have heard a lot of teachers say, don't give your kids hot fries or anything with red food coloring because they'll be bouncing off the wall. Is that what you mean by some of the processed foods?
Yeah, no hot anything ever in life. Please ban. Don't ever buy. That is my personal take on that. I saw kids with ulcers and stuff like that. So that's an out
Mm.
topic. But it
Wow.
absolutely is. Those processed food in its most natural states is best. Those processed foods a lot of times have ways that actually work with even the DNA, to be honest with you, and there are
Wow.
hormones, so they really have an effect on the brain development. And again, they're really they usually have high sugar or high types of carbohydrates. Nutritional value is nil, and that's a problem. And
Mm.
again, casein and gluten, the way they come in foods are a little, not well understood. So, as a plant-based is best. Fatty fish is awesome. So again, there are lots of reasons why those red dye, yellow dye, number seven, I'm thinking about daddy daycare, where they, where they,
Okay, we want the real stuff, not the dad daycare stuff. Don't play
Right,
with
right.
dads.
right.
No, I
Giving
mean, a
dads,
lot of
giving
children may
dads a bad name out
I
there.
know, I know the movie, the
no,
movie.
it was a movie with
It
Eddie
was a
I
Murphy.
movie.
know,
It
I
was a
know, I
Yeah.
movie.
know, I know.
Wanted to
But
just give
but the
dads a
issue
bad
is
name.
it there are things that affect the gut, which is our second brain, and sometimes people have heard that because it helps with neurotransmitter development as well as a lot of microbiome things. So when you mess with that area of the body, that digestive area, it significantly impacts the way that the brain can function just because of the way that there is that brain gut interaction.
Mhm.
So,
And if y'all
Gotcha.
want to hear more about that microbiome, go back and look at our show from over the summer with Dr. Robin Chutkin, where we had a whole thing on the microbiome, all those
She was
helpful
excellent.
bacteria. She was excellent.
She was
All
excellent.
those helpful
I want
bacteria
to
in our gut.
get in a few other
Yep.
statements, and maybe you could discuss them quickly. This is a lightning round.
All
So,
right.
Karen Thomas Ginyard said, IEPs are for learning disabilities. If there's no learning disability, 504 plan can be implemented. Can one of you speak to the 504 plan, please?
Tiara.
Absolutely. So 504 plans can be implemented if there isn't any identified learning disability. It's the same thing, except for there's no learning disability. So a child who's diagnosed with ADHD, um, they would need the same accommodations to be able to maintain in class and get assignments completed, but they haven't been identified as having any deficits in their learning.
Mhm.
So they're pretty much on grade level.
Got it. But they
Okay.
still need the
Yes,
assistance. Yeah.
absolutely.
And the big thing is finding a 504 plan for adults, because I mean we still have adults that never got stuff
Mhm.
addressed when they were young.
Absolutely. And so
Right.
that's my platform. And so that's the importance of checking out a licensed social worker or a licensed counselor. We kind of do the same thing, just a different discipline. But nonetheless, speaking with one will help you to identify, what areas you need to improve on. When we're talking about ADHD, we're talking about behaviors. So there are behaviors that you will want to change, that you want to find ways to not have those negative behaviors be around and you replace them with more positives. So what therapy does. In addition to other things, but certainly for people with ADHD may think, oh, I don't need to go to therapy. Well, it can help to
Yeah.
identify some substitute behaviors to help move on with life.
Embrace therapy. Bottom line.
Absolutely.
Mhm.
Larisha? Yeah.
The last question for me is just parents who have to or have children who might have a specific diagnosis, ADHD, ADD, they may find themselves worrying about, what they need to do or making sure that they have the proper care for their child. Are there any coping mechanisms that you would share that parents could implement to keep themselves focused and calm, and not worry so much about their child's health?
1 minute.
Yeah, okay, absolutely. So I say again, reach out into your community and find someone that you can go to help through this process. But it's a behavior. And so changing behavior is a big deal. So creating a system in your home, routine is a big deal for students and parents with ADHD. And so a lot of times parents get frustrated, they want to start yelling and stuff. So that's where family therapy will come in because we will support parents in finding appropriate ways to manage their children and put different techniques in place at home as well to help them be able to organize, have a more calmer environment.
And realize that it's a health condition, not quote unquote bad kids. Right.
Absolutely.
Yeah.
Got it.
Wow. Well, thank you both. You all have been just outstanding. Thank you, Dr. Bradley. Thank you, thank you, Tiera York-Jones. I almost call you doctor because all your information was so excellent.
Uh-oh.
Thank you both. And thank you so much for joining us. And we will see you shortly because we have one little thing to wrap up, right? From our set.
What y'all think?
So what did people put in the chat?
People said they didn't code switch. People don't code switch.
Really? Okay. All right. So that study was done in California, so maybe all the rest of the country doesn't code switch.
I don't know about that because I know a lot of people down here in Georgia in the South code switch. They have their business voice and then they go back to that country twang that we all know about. So, um, yeah, I think some people might just not be telling the truth there.
Well, I think the bottom line is don't avoid care because you're concerned. Just learn how to advocate for yourself. Tune in every week to Excuse Me Doctor because that's what
That's
we
it.
do. Or get the book, Excuse Me Doctor. I've got what? Taking ownership of your health and making health care work for you. So
Say it
I
one
want to
more
thank
time. Say it one
y'all.
more time, Dr. Mel. Say it one more time.
Excuse me, doctor. I've got what? Taking ownership of your health and making healthcare work for you. That's what we're all about, making sure that you can advocate for yourself. So I love that segment. We just have to keep doing that. We're gonna have a whole bunch of what y'all thinks.
What y'all think?
So on that note, thank you so much, Larissa. Thank you so much, Wayne. Fantastic co-host. Great questions from the audience. Thank you, audience, for tuning in. And before I go, I got to make sure I get in to remember that Howard University COVID resilience research study. They're inviting you to participate. All you have to do is fill out 2 questionnaires, and you can get paid up to $100 to compensate you for your time. If you have any interest, please email the email that you see there, Dana Harvey research@gmail.com. That's Dana, Dana, Harvey, Harvey, research@gmail.com. She will get right back to you and tell you all about the study and how to enroll. So thanks again for tuning in. That's it for this week on Excuse Me, Doctor. And until I see you again, remember, be wise, be well, and be health empowered. Thanks for joining.
They invited me. They still don't know. I hooked up with Dave 3 days ago. He'll start coughing tomorrow. And I bet in 10 days he'll be on a ventilator. Now, his wife, she's not vaccinated because she thinks it'll prevent her from being pregnant. But what they don't know is that I can decrease sperm count. Sorry, Dave. Good luck with that.